All right. Welcome, everyone. Thank you for being with us on this smoky Monday afternoon. Welcome to the September 14th, 2020 meeting of the Oakland Economic Recovery Advisory Council. I know it's been a really strange and long few weeks in the Bay Area with the fires and the smoke. So just want to share that I really appreciate continuing to participate and show up with this work. We have some great presentations today, so I know we're probably all eager to get into the agenda for the day. So just walking you quickly through what's going to happen this afternoon. You should have all received prior to this meeting an email from Marissa with the interim report of the Economic Recovery Advisory Council. Thank you all for your contributions and for your input. And just to remind everyone, this was meant to be our sort of midpoint, although we're a little past the midpoint now, report out on everything that the Recovery Council has been doing, the things that all of you, the members and our different city and government partners and stakeholders have done to date, and also to really point the way towards all the things that still need to be done. So I encourage you all to please take a look at it. Let us know if you have questions or comments. And we will be moving towards our last meeting, which is next month in October. And after that meeting, we will be issuing a final version of the report. So today's agenda, we have a busy agenda. We're gonna hear from our facilitator, Michael McAfee and Michael Weinberg, just to share some framing and some updates on where we are now. And then you're going to hear from Marissa, who's going to share some information about what the city has done and been doing, and some data report outs about what we've been seeing. Now that we're starting to gather data, 6 months, hard to believe we're 6 months into the pandemic, but we've gathered some data about disparities through our partnerships with the Health Recovery Task Force and the county, and so Marissa's going to share some of that information. Then we're going to hear from Anika Chaudhry, who's the Director of Strategic Initiatives and Public Affairs at Alameda County Healthcare Services Agency. And I know that one of the things that's really been elevated throughout this process is the need for good collaboration and communication between the city and the county. So we're really grateful to have Anika here to speak directly with the Recovery Council and take questions. And then Jose Corona, one of our facilitators and convening leads, is going to share the incredible work that his organization has done, the Eat, Learn, Play organization has accomplished with through their partnership with Oakland Restaurants and World Central Kitchen. And then we're going to hear our last presentation from Mark Everton with Visit Oakland, who's going to share some really exciting and cool news about what his group has been working on around the Spend, Stay, Love campaign. So with that, I'm going to go ahead and hand it over to Micah Weinberg, who can kick it off with our introduction. So Micah, you should be on unmute.
Thanks, Alexa. I don't know that I have that much to add, but I did want to say, something sort of by way of framing. But first, just really want to appreciate the work that Alexa and Marissa and Brandon and all the other city staff members have put in, not just to produce a report that you'll see is beautiful, but to produce a report that's really meaningful. It flags a lot of substantive work that's been done, but also a lot of work that remains undone. So thank you so much for all of the work that you've done on that. And there are some successes. I mean, the World Kitchen thing, it's just been really amazing. Looking forward to hearing about more about that later in this agenda. And so many people have been working so tirelessly, either through official city channels or just organizing in their own neighborhoods to make this period better than it could have been otherwise. And there's just so much that we haven't been able to do. And I think it's important to say that this is intended to be an advisory council, which advises. So it is necessary and proper that we also point to a lot of things that haven't happened. Now, the city, only has so much control, but whether we're talking to the city or the county or the state or the federal government, we have a tremendous amount of unfinished work to do. And so this document is intended really to highlight that and call for that work to be done. So as we move through the rest of this advisory council process, and as we take a look at this interim report, please know that we are very comfortable calling out progress where it needs to be made. That is really, in fact, our charge here. So I just wanted to add that to your remarks, Alexa, and just really appreciative of all the work that you and the staff have put in, and excited to get into the rest of the agenda today.
Thank you so much, Micah. Appreciate that. And thank you to you and Michael too. I know that all of our conveners and facilitators are, they're all doing this on a volunteer basis, and we really appreciate all the work and the time and the expertise and the energy that they've brought to this process. It really has helped certainly me and the city just be better and learn a lot about how to move forward as best as we can. So thank you. I'm going to hand this over to Marissa now, who's going to share some of the data that I mentioned earlier that we're starting to aggregate about racial and ethnicity disparities in COVID rates. So Marissa?
Thanks, Alexa, and thank you, everybody. It's really good to see you this afternoon. I wanted to start with one of the key disparities that we set out to frame the advisory council's work, and that's with the coronavirus case and death rates by race and ethnicity in Oakland. And for this data, we have collaborated with our health disparities task force. That's Oakland's other big interdisciplinary task force that's advising with recovery. And we have been talking a lot in this last month with the staff from that task force because of our focus on reducing transmission rate in the workplace. And you'll hear from Anika Chowdhury today on some of the efforts along those lines and the responsibilities both of business owners and of workers, and some of the programming aimed at both of those groups to try to increase safety in the workplace. So to start off, one positive trend that we're noticing, if you're following the Alameda County coronavirus case updates pretty regularly, you will see that we are coming down in the total number of cases. And we're coming down rapidly in the number of Latino cases. Far and away, the largest proportion of cases in the county have been in the Latino community. And while they have increased and kind of plateaued in the Black, Asian, and white communities, they are starting to come down in the Latino community. Can we go to the next slide, please? What this means from a disparity analysis, to calculate a disparity number, we look at the case rate per 100,000 people, and then we look at the ethnic group that has the highest case rate and divide it in ratio to the group that has the lowest case rate. So if there was no disparity at all, that ratio would be 1. We started with a disparity in April of around 7 between Latinos and whites. And now in August, we had a big surge and a big increase, and now we are back down to 7. So the disparity is starting to close, and we hope that will continue. You'll see also that case rates have gone up for both Latino and white. Next slide, please. Oh, the reason that slide just shows, each of those disparity slides just shows the highest race ethnic group and the lowest race ethnic group in order to calculate a disparity number. So these cumulative numbers show you all the race and ethnic groups. This one is a little bit harder to talk about because it's our coronavirus death rates, and this is for Alameda County, not for the city of Oakland. The death rate for the Black community has been the highest out of all the race ethnic groups. There have been about over 300 deaths from coronavirus in Alameda County, and about 60 of those have been Black residents. Part of that is the age cohorts where the cases have been hitting, and the impact on nursing homes in the county. So if we could go to the next slide, please. That disparity is also starting to decline, but it's not the most positive of news. It's partly because the death rate, which we're comparing to for looking at the disparity, is starting to come up. So The lowest death rate is in the Asian community. That increased from 2.7 to 5.2 from spring to summer. We also saw an increase in the Black community. So the disparity rate for deaths in Alameda County is 2.5. Could we go to the next slide, please? For this group, we have really focused on zip codes and highlighted 3 of the heaviest impacted zip codes in Alameda County, which are in East Oakland, Central East Oakland, Elmhurst, and Fruitvale. What we're seeing there is also a good trend of a case rate declining, most drastically in Elmhurst, which had a really big surge in July and is starting to come down. Also declining, but more slowly in Central East Oakland and Fruitvale. And I'm hopeful that when Anika joins us, she can talk about some of what's making a difference there in terms of the additional testing sites that have been stood up, some of the safety education, which I think we're in agreement that we need more of as well as some new county efforts such as income replacement for workers who need to take sick leave, as well as opportunity to quarantine. And with that, I'd like to turn it over to, let me make sure she's joined back on. Anika, are you back with us? She was having a sound issue and let me know that she had to come off for a second.
Hi, I'm back.
Oh, great.
Sorry about that. There was, yeah, I could not for the life of me hear anything. So if you were saying anything about me, I hope it was good.
All positive. Thank you so much for joining us today. It's been really a pleasure working with you and collaborating. Do you have a slideshow? Do you want us to give you permission to share or?
Yeah, that'd be great. I just have a few slides and then we can leave it open for a Q&A mostly.
Okay.
Okay, you should be ready to go, Anika.
Okay, thanks. All right, can you see my slides?
Mm-hmm.
Great. So hi everyone, Anika Chowdhury with Alameda County Healthcare Services Agency. Glad to be able to join you today and thank you all for all of the work you're doing in the community. So I think you just saw a few slides on overall case patterns and death patterns in the county by race and ethnicity, and some of those disparities are persisting. But this is just a snapshot of our dashboard, which was taken, I think last night or this morning. And we will probably hit 20,000 cases in Alameda County, since we started measuring in February. Sometime this week, we've got a little over 332 deaths. And those numbers do include the case and death numbers in the city of Berkeley, which has its own separate health department, but we coordinate with them fairly regularly. And then Oakland itself continues to represent about 40% of the cases. And as you saw in Marissa's slides, our Latino communities continue to have the highest rates. And as the pandemic has gone on, we're seeing on this graph here, if you can see my cursor, is that it's now starting to skew younger and younger in terms of where the cases are. And the deaths are still a little bit on the older side. So looking at, sorry, let me do this. So looking at the death rates, as you can see, the older you are, the more likely you are to die of this disease. But we've been pretty fortunate to have a relatively low death number. Hospitalizations is another really important metric that we follow in this because obviously we don't want to have our hospital systems get overwhelmed by COVID hospitalizations. And all of these graphs basically are just showing that we have sufficient hospital capacity right now, including ICU beds and ventilators. And in the county, we have, I think, over 1,000 surge beds, meaning that those would be activated should all of the other hospital beds be full. And we've not had to tap into that surge capacity as of yet. So we're doing pretty well on hospitalizations. The California, I'll just talk a little bit about the Blueprint for Safer Economies. So many of you probably follow this pretty closely. So You're aware that we are, a couple of weeks ago, the state issued a new blueprint for a safer economy, and this, it changed it changed the criteria for certain businesses and sector reopenings. And this is a way for them to sort of standardize what's happening in counties across the state. And if metrics fall across two tiers, mostly they're looking at the disease burden, which is measured by new cases per 100,000 over a 7-day period. And they're looking at our testing positivity rate. So you could be in two different tiers in those, as Alameda County is, but you're placed in the most restrictive tier. So we're in the purple tier, which indicates widespread disease. And we do have more than 7 new cases per 100,000. But as you'll see in the next couple of slides, our test positivity is actually lower than that. We have also heard from the state that they are considering a health equity measure, which will be unveiled and sort of implemented as we go over the next few months to try and reduce some of those disparities in in COVID. So Alameda County status, we are in the purple, and CDPH is doing these assessments every week, and they'll be posting them every Tuesday. And so a county has to stay in the same tier for a minimum of 3 weeks before we can move to the next tier. And even if our tiers make, if all of a sudden we're doing great and in disease containment and we're suddenly in the orange, we would still need to go through red and spend 3 weeks in the red before we could go down to orange. And again, this is with the idea that we just kind of want to slow everything down a little bit and create some more uniformity across what's happening in the state. So looking at our case rate, this is, the line here indicates the 7 cases per 100,000, 7 new daily cases per 100,000. And as you can see over the past, few weeks, we've slowly been trending downward, which is great. And that's what we want to see. And this graph was based on our data. And sometimes there can be discrepancies between our data and the state data. But we anticipate that, hopefully this downward trend will continue, and we're hovering right above, right at the purple and red line. For testing positivity to be in the red tier, you need a positivity, but this is overall throughout the county, between 5 and 8%. And we've kind of always been in that area. And then again, it looks like over the last week, we might be dropping below that, which would actually put us in the orange tier for this. But again, we would stay in the most restrictive. So if for our case rates, we're in the purple, and in our test rates, we're in the orange, we're still going to stay in the purple. And so what
Anika, you're falling off a little bit. Can you speak up a little bit?
Oh, sure. Is this better?
Thank you. Yes, thank you.
And then in terms of activities and businesses, as I mentioned earlier, this alters some of the plans for businesses and activities that may have, that were previously not allowed to open, and sort of changed other things up for ones that were allowed to open. So for example, in Alameda County, we had retail stores open at a 50% capacity, but to align with the state, which was more restrictive, we've had to go down to a 25% capacity. Grocery stores, we didn't have a capacity limit on it before, and they're now open at 50% capacity, again, to align with the state. We had not opened up indoor salons and barbershops, and as of a couple of weeks ago, we opened those up to align with the state as well. So as with all health officer orders, the states, the local counties can continue to be more restrictive than the state. And so as you'll note, going forward, we have decided not to open up to everything that the state may say is allowed in the purple tier. So sorry for this very busy slide, but I think the only thing you need to know from here is that I just kind of went over what these different capacities and limits are. We also allowed as of September 4th, some new recreational activities that were technically allowed with activities that we had already, we had already permitted, so mostly related to outdoor fitness or outdoor recreation, and much to the chagrin of small children everywhere. Bounce houses, ball pits, playgrounds, and anything with shared equipment still remains closed. And then just this past Friday, we updated our vehicle-based gatherings order because we've had a lot of requests and questions from the arts community about, wanting to think about live performances. And so we feel comfortable doing that in a vehicle-based gathering sort of way. Our current order permits vehicle-based events of up to 3 hours and up to 200 cars. As of today, that upper limit for the cars has been increased to 400. And we issued, in the order, just some general guidance asking for the for event organizers to let us know what their plans are for physical distancing and face coverings and effect for the performers and any production staff. And so we want to see that, and then we are working with various organizations and would like to pull together a group of people to really help think through guidance that actually works for performers and for the venues. Another big change there is that we are now allowing the sale of concessions at those events, which was previously prohibited. And then if you were to go on the state's website and you click on Alameda County, it'll say there's a bunch of things in the purple that are permitted, and those are technically permitted per the purple tier, but on our website we have a list of authorized businesses, and if a business or activity is not expressly authorized in that list or in our orders, they're not permitted in Alameda County at this time. So you heard Marissa talk a little bit about the priority populations, and some of the disparities that we've seen. So one of the approaches the county has taken to reduce those disparities is focusing on these 5 areas that you see here, and they encompass multiple zip codes. So the idea being that, in these zip codes and these areas is where we see the highest case rates. So what we've done is, throughout the course of our pandemic response, we've opened up testing sites specifically in or near those areas to serve those populations and make sure that we're getting people tested appropriately. And then Marissa also mentioned the ARCH program, which is something that we recently launched. It's available to residents who live in these areas and test positive for COVID-19. And what this is doing is providing a stipend of $1,250 to help people isolate and quarantine, so that, or just isolate, in case they need to miss work or they've got other expenses that they would need to take care of if because they have to stay home. And so as you'll notice here, much like the data that Marissa showed you, is that among our Latino communities, which are in the gray area here on the left, looking at case rates, it's those among that community or those communities, there are higher case rates compared to the county as a whole, and to other races in general. Among African Americans, our case rates are higher in certain places, and not as higher in other places, but so I'll leave that one alone. And then as we look to the right, this one is showing our test rates broken down by race and ethnicity, and we're trying to get these, ideally what we'd like to see is this upper part of the graph here where we would want to see all 5 of these bars be equal. And we're close to that in some areas like South Hayward, but then as you'll see in some of our Oakland neighborhoods in particular, and in the Latino community, the positivity rates are just very, very high among some communities. So when we look at case, this is also another very busy slide. So looking at rolling 1 week average of case rates per 10,000 population in this case, you can see that the county average is in green. And really wherever at, the rates that we're seeing in South Hayward and East Oakland are much higher than the county as a whole, and they kind of drive what happens in the county as well in terms of our overall rates. So just in terms of some of the resources and supports that we're putting into the priority neighborhoods, testing I mentioned, we've got now 11 sites that are throughout the county, community sites that serve communities, and we are also working on doing some more of a pop-up model and mobile testing sites. And so we have a rolling RFP that is available to testing providers and labs. And so it's a matter of just getting those going and keeping them going. And then case and contact investigation. So we've also issued our first round of the, or this is another rolling RFP that we have, with the idea being that we want to, we have a goal of getting to 300 contact tracers to serve the entire county. Within the agency, we have a little over 130 people trained. And the idea is that we want to get to that 300 in partnership with community. And so we have several community clinics that are listed here. So West Oakland, La Clinica, Roots, Tiburcio, and Tiburcio Vasquez, to serve those high priority neighborhoods. And then we also just received 36 new proposals for other community providers to help us respond and expand what they're doing with the case and contact investigations. And then outreach and health education. So we have brought on a consultant to help us think through the next phase of communication for our response, because it's been very much crisis communications for a long time, and we want to think through, you know, working with the communities and having trusted messengers go out and help us get the word out, not only about sort of some of the evergreen messages about, you know, wear a mask and stay home if you're sick, but also thinking through getting a flu shot and building some of that trust that we need for deployment of COVID vaccine when that time comes. We also have a youth campaign going that involves some stipends, and they're active in each of these areas. So that is all I have for you right now, and I'm happy to answer any questions.
Thanks so much, Anika. I know we had a few questions from Councilmember McElhaney in the chat that we can go up to, and I know we have a large representation of the business community in Oakland here, so I assume there might be some questions if we go about the slide regarding which businesses are allowed to reopen specifically, and sort of what specific steps the county is taking to protect workers. But looking back on some of Councilmember McElhaney's questions, she asked about if there's an availability of any clusters by worker industry or by families with children. Is that data available?
Yeah, so that is a very good question, and one of our priorities for the next set of data that we're looking to release. So one of the issues that we have is that you know, a lot of the data are missing information, either because people don't feel comfortable sharing it or because they didn't report it at the time that they were getting tested. And so of the data that we have complete information on about half of the cases who, you know, or a little over half the cases who report having had a close contact with someone. And within that group, about 2/3 of the people who had a who were COVID positive, and of the contacts who had close contact with somebody who was COVID positive, had that exposure through a household exposure. And so that can include anything from gatherings or, you know, people in your family or people in your social bubble. And in terms of workplace, we're slowly seeing that number increase, but it hovers around 14 to 18%. But I think as we open up more and more sectors, we're interested in seeing not only if there's transmission happening at the workplace, but also which sectors in industry might be having more transmission. And a lot of this, so as you may know, we do require all employers to report cases among their employees, whether that case happened, whether that transmission happened at work or not. And so what we're trying to do is align some of that self-reported data from employers with our data that we get from the state and CalReady. And we plan to issue that very soon. Our analysts are working on it right now.
Thank you so much. Anyone, if you have questions, please feel free to put your hand up or just take yourself off mute and ask them. Another question from Councilmember McElhaney was about with the change in the county order allowing sort of outdoor gatherings and performances, which I think is probably very exciting news for one of our working groups that's focused on sort of cultural activities and performance space. There was a question about, like, what does this mean in terms of park usage? And I know that's more of a city question, but I'd be curious to know just sort of what the county's sort of anticipated use was, or what you're hearing maybe from other cities about starting to allow more outdoor activities in public parks and spaces like that.
Yeah, I mean, I think so. I do want to note that we're not permitting gatherings, but it is specific to vehicle-based events, and so to the extent that that allows some creative use of parks or other spaces that we have to be able to enjoy cultural events, we're open to that. And our COVID recovery team would be happy to troubleshoot and provide any technical assistance on thinking through what that can look like for you. We don't need to necessarily approve the plans, but we are interested, and we've been hearing a lot from various arts communities and groups about safe ways to do this, right? And so the idea being that if we don't necessarily, so for example, if you have like a live performance by a band, we wouldn't necessarily want there to be a gathering of people to be able to watch that in a park. But maybe there's ways to physically distance, and if people are in their vehicles, they're a little bit protected. And then it's a matter of figuring out if all of the performers and the production staff are also safe and able to do this in a way that doesn't promote transmission of COVID.
Great, thank you, and thank you for clarifying that. I see Lizandra has her hand up, so Lizandra, you want to take yourself off mute?
Yes, hi Anika.
Hi.
My name is Lizandra Dial. I'm the interim executive director for the Workforce Development Board here in Oakland. And I know that the state, my question is around the contact tracing. And I know that the state has an overall goal of hiring, I believe, 10,000 contact tracers. I want to know, is there an opportunity for the workforce boards to partner with the county in helping to staff up? One of the things we were hoping is, how do we hire some of the folks that have been dislocated as a result of this to be contact tracers? This is a nice temporary job until the next thing. So does that opportunity exist? And if so, I would love to follow up with you.
Yeah, I'd be happy to talk about that further. And I will note that, because our county hiring processes are, they can be very slow, is part of the reason that we're really excited to partner with the CBOs in order to hire people. And so one of the requirements, for the RFP and for people who are making proposals to us to be able to do contact tracing and to get funding to do that, is that we've asked them to describe to us how they plan to hire people who have been affected by COVID-19 or have lost their jobs, are from the communities that they're proposing to serve. And so I think there's good connections to be made there, because it's easier for CBOs to bring people on quickly. And many of them are already working with disproportionately impacted communities.
Great, thank you.
Yep.
All right, does anybody else have any questions for Anika while we have her here? This is our chance to ask questions directly to the county.
I'm sorry, I'm trying to catch up on the chat here. Yeah, I think Councilmember McElhaney, the issue about permitted events, yeah, I think that the gatherings question is a difficult one, but I think that to the extent that if there are things that cities want to do and want to issue permits, again, we can work with you to see what would be allowed or not allowed. But at this time, any gatherings of people, it's hard for us to get around that, and it's really difficult to message to people that it's okay to gather for one specific thing, but not for another.
Thanks, Anika. Does anybody else have questions? Okay. All right, with that, I know there was a question to Anika about sharing the slides from this presentation. So hopefully we can share those out. We typically post all the materials from the meeting on our website afterwards. So if
I
it
can
works,
send those to you.
yeah, we can post them there. So they'll be available for everyone after the meeting. All right, thank you so much. We really appreciate you making the time. I think if nobody has any questions, last chance, we will move on to the next portion of the presentation, which is we're going to hear from Jose Corona, one of our co-facilitators and conveners, about the work that his group has done with World Central Kitchen and supporting Oakland's restaurants. So Jose, are you there? Are you off mute?
I am here. Thanks so much for having me. And welcome again, everybody, for showing up today on a Monday. And this is not a TikTok screen. These are real glasses. I think all the Zoom over the past 6 months has put an impact on my eyes. So, so here we are. So anyway, I was asked to talk a little bit about today. There's supposed to be like a text screen in there, but I guess it's not showing up. But it's all good. For those of you that don't know about Eat, Learn, Play Foundation, you all know Stephen Curry and Aisha Curry that have been beloved members of the Oakland community for the past 10 years since Stephen has played with the Golden State Warriors. Oh, thank you, there it is. Must have been some kind of, I don't know, movie.
Animation, I had to click twice.
Yeah,
Sorry.
some animation, yeah, sorry. But anyway, here it is. But for those of you that weren't familiar with Eat, Learn, Play, he founded the foundation, or they founded the foundation in July of last year, really with the focus of providing nutrition education, access to resources to provide access to a good education, and creating safe spaces for young people to play, with the whole premise that how do we get families to eat, learn, play together? And if you eat well, you play safely and healthy, then you're able to learn and pursue education and career. So we had a very nice strategy coming into 2020 at the end of 2019 of how we were going to accomplish that. And then March hit. And March hit, as you know, and created everything that we're talking through right now. And during that time, I think actually right before the school shutdowns on March 13th were announced, that week we had met with the Currys, and they had asked, if something really drastic happens, how are we going to allocate and dedicate our resources? Where is our focus going to be? And we decided that we were going to focus exclusively on our EAT pillar. And starting with the OUSD's kids who depended on schools for their daily nourishment, 18,000 of those that were going to go hungry if they didn't go to school. We wanted to make sure that we provided meals, starting with the kids that were going to miss those meals. Quickly, it became worse. As you all know, families started getting laid off, and we saw entire families coming to OUSD sites to really pick up meals. And then we expanded the partnership again with Alameda County Community Food Bank, and then World Central Kitchen, who had some presence already in Oakland when the Princess cruise ship was here, docked. They were feeding the crew and the people that were in the cruise ship. Soon after that, obviously, we got into this pandemic, so they had some connection to Oakland already. But Aisha, being a chef herself, reached out to Chef Jose Andres and says, how can we do this in a really big scale to really show the value of what restaurants mean to every community, but especially here in the Oakland community? So if you go to the next slide, that's really where we really formed a very strong partnership with World Central Kitchen. Together, we were able to reach out to a lot of investors, partners out there, including the Audacious Project, which is a big fundraising arm of the TED. If you guys know TED Talks, TED. The Audacious Project is a platform that brings together a lot of high net worth individuals to really fund audacious projects. So we pitched the idea of making Oakland a model for the country on how we can really see the value of restaurants, not only as social gatherings or people to really treat, to serve customers, but really look at restaurants differently on how they feed community. So there was where we were born as a partners, and together we have been since working really closely over the past 5 months on this effort to really engage Oakland restaurants as a means to not only feed communities, but also keep them open and rehire employees. You go to the next slide. So I think one more click should update. So together, since March of 2020, we launched this partnership. And over the span of that time, we've engaged 130 local restaurants. Go back. I don't know why it's doing that.
Sorry. There we go.
130 local restaurants, 70 of which are minority-owned, women-owned businesses. And we were very intentional about that. We really, when we looked at which restaurants we were gonna engage, it was not about playing favorites, and it was not about the people who I knew. I mean, obviously I've been in Oakland for the past 17, 18 years, so I know a lot of the people that have been engaged, but it was not about playing favorites. It was really taking a priority of those institutions that had been in Oakland for at least 7 years. And that's what we really said, let's look at the ones that have really made an investment and really set their foot and presence in Oakland, and really prioritize those that have been here for a while. So it's not about the newcomers that just have been here a few years, even though they are involved now. But we started really looking at the ones that have become really community institutions, for lack of a better word. So we started with those, and then we expanded to now the 130 restaurants. And some of you might ask why we stopped at 130 restaurants. I think there's a couple of reasons there. One, we wanted to make sure that we were able to manage the coordination that exists between the 130 restaurants and about 140 local organizations where the meals are being delivered. But there was also nutrition standards that we set about providing protein and certain nutrition standards, less salty, less oil. And, in some cases, some restaurants said, this is how we cook. We're not going to change our menu. And we can, if we want to be engaged, you're going to get our meals. And we said, well, thank you, but, we really want to feed quality, nutritious meals to our community. It's not about just feeding any meal for meal's sake, but we're going to provide the same quality and nutritious food to these organizations and the families and individuals they serve. Because they deserve that. They deserve the quality, they deserve the experience, and we wanted to ensure that. The other reason is that there's others, if you look at Oakland, there's many, many more restaurants, and some of them just did not have the capacity to do, 100, 200, 250 meals every day, which was required based on our current rate, which is doing about 85,000 meals every single week. So on a weekly basis, these 130 restaurants are churning out 85,000 meals to 140 different locations across the city of Oakland, anywhere from 100 meals a day to 500 meals a day. It just depends on, and we rotate. So it's not everybody just getting the same business all the time. The great thing about World Central Kitchen and what we've developed is that we rotate. So we get everybody a good opportunity for variety. So also, if we work with the Black Cultural Zone, so the Black Cultural Zone is not getting 7 days a week. They're not getting meals from a Mexican institution, like Huarache Azteca. So they're not getting Mexican food every single day. We make sure that they get a variety as well. And where appropriate and where requested, we also make it culturally appropriate. So there are some institutions that say, don't give us anything with pork. That's against our religion. We want the meals to be different. So we're very accommodating that. So we asked those questions from the beginning. So I think we are very proud that we meet families and institutions where they are. So fast forward from March to now, we've delivered over 1.3 million meals. which means that we put about $10.2 million of revenue back into the Oakland economy, into the restaurants, which has allowed these restaurants to rehire and reemploy 825 of their kitchen staff. So we're proud of that, even though that our mission is not necessarily around job creation or economic development as an organization. Our first and foremost priority was making sure that no kid and no family went hungry during this pandemic, and we were going to meet the hunger need where it was. That was our first priority. The secondary, I mean, it was a passion of mine. Obviously, where I come from and what I do and what I've done in my past is a secondary, but equally as important outcome, which was the recovery of restaurants. So again, you know, partnering with these restaurants, again, when you look at 85,000 meals a week, that means 850,000 going into the economy every single week. So that's important for us to highlight. That's important for us to mention. And then in addition to that, we started working across the supply chain when restaurants started saying, well, you know, we used to buy directly from our farmers, and they're throwing away their food because they can't sell it to us anymore. They can't sell it to others. Is there a way to engage farmers in this? And we did. We worked with Full Harvest that works with family-owned farms, and we were able to add produce boxes to the mix of where we deliver meals. So in addition to delivering hot meals from restaurants, we are now delivering 15-pound produce boxes from local farms with the produce that is in season. So that's an additional, again, going down the supply chain and figuring out how do we support, in a way, the economy all the way downstream. So another question that often comes up is, how long is this going to last? And one of the things that we are committed to is that we are committed to helping support this effort as long as the need is great. Right now, with the current funding that we have put into the effort and raised from other partners, that include folks like Cat Taylor, Salesforce, Ripple, so many partners that Kaiser Permanente just made a huge investment into this. We want to keep this going. And right now, with the current funding, if no other funding was made available, the funding would run out around mid-November. That's the run rate that we have right now. Of course, we're making strides in figuring out how philanthropy can play a role in another tranche of funding. But as you'll see in the next slide, we also are looking at what other strategies can be employed to really look at how government, mostly from the state or federal government, invests in restaurants as they look at the new role that restaurants play in a community, looking at them as a vehicle to continue feeding the community and really recognizing restaurants as a community assets. You hear Mayor Schaaf talk about restaurants being culture keepers, and I really believe that too. I really believe that restaurants, and even the stories that I hear every day from the restaurants where I'm in touch with many of them, they always tell me, like, look, we should have been doing this every single time. It's not just about the customers like you and me that come and pay for a meal on a social occasion. We want to continue feeding the unhoused. We want to continue feeding the seniors, the elders, the foster youth, those families that need the meals right now. We want to continue doing that. So to the extent that they can help, they want to help. But I think it really takes some concerted investment. And I really believe that government, whether it's through the USDA, through redirection of FEMA funding, which is possible, to really support ways to invest in restaurant industry across the country, could be a really powerful tool to keep this industry going. There's policy approaches that are being taken that we're looking at, not necessarily embracing, but we're looking at, for example, tax credit for providing healthcare, because the future of restaurants is important, but it's also important when you recognize that it's also one of the industries where it's the lowest paying jobs. So you take away revenues, you take away how restaurants have been economically impacted. You really have to look at a new model that takes into account potential labor model. So if you take restaurants going from 100% capacity to 25% capacity, and then bringing back their staff, whether it's a waiter, and then sometimes they're not accepting tips anymore, but you're still paying the same wage before, it doesn't pan out for the individual. So we have to look at different ways of how restaurants are going to continue operating. There's some discussion by some restaurants, even here in Oakland, that are saying, we want to really pivot to potentially become a co-op where our employees have ownership in this. So it's a wealth building opportunity, not only for the entrepreneur, the person who started the restaurant, but how do they create these co-op models, ESOP models, where everybody benefits in as long as the restaurant is profitable and getting revenue, then there's a way for them to rethink themselves differently and reorganize themselves differently, but they need support. So I think based on what I know of the ecosystem that Oakland has, the technical assistance institutions that exist, and just people on this call, all the 41 of you that are on this call, you care about this industry, how we can all come together to help restaurant industries on the individual and also collective basis think about a new model of how they operate is something that I'm willing and able to commit to. And I think as a foundation, we want to put resources behind because we see that importance of continuing to feed families. But I think it takes that village, it takes that ecosystem of support to really bring a new model of how we continue just supporting the restaurant industry going forward. And I really believe that if you help the restaurant industry, we inevitably it has an impact on how other small businesses get impacted as well. There's a correlation to how we can benefit other small businesses in retail if we concentrate our efforts. I mean, not concentrate, but if we really pay attention to supporting the restaurant industry, I really think that if we help that industry, it helps other industries as well. Because the other conversation that I hear is, how can we support our other small business friends out there that could potentially, we create this local economy ecosystem where we can buy from each other as well. So amazing conversations that are happening at the restaurant individual level. I mean, I want to give huge shout outs to all the restaurants that have done their part in this effort. I know that, for the $10 a meal that they get paid, I know it's not everything, but they've done so much with that money and rehired people. And just the gratitude that I have to express to the restaurant industry, to the restaurant owners. I mean, running a small business is hard. Running a restaurant small business is even harder. And running a restaurant small business that has a social mission looking towards the well-being of employees of the future is just heroic. So I really think that we have an amazing Oakland community here, and we have amazing small business owners, amazing people that it just, coming into this recovery council, I was, I don't know, what are we going to be able to do, but just based on the strength of what this community has, it gives me a lot of hope that Oakland can be in a good place if we all really come together. And I know it sounds really cliche, it's like we all have to come together, but I really believe it. That's really something that has given me hope over these past 5 months, is the resiliency and just the ability of you business owners on the ground that have done your part to say, we're going to plow through, we're going to be resilient, and we're going to come out of this better. And I really believe that. So with that, I just want to say thank you to everybody. Thanks, Alexa, Marissa, everybody for convening us, but happy to answer any questions that anyone may have.
Wow, thank you so much, Jose. It's amazing what you all have been able to accomplish, and it really is inspiring. Does anybody have questions for Jose? I know there were a lot of chats in the chat screen. Does anybody have any questions or comments?
I do. Will this effort continue post-COVID, or is this strictly for COVID?
Right now, it's the funding that we've raised has been based on COVID, but we know the pandemic is not going to go away anytime soon. So again, as I mentioned, we want to make sure that we bring as much as we can support philanthropically. We want to continue as long as we can. But again, we were looking for other opportunities where policy or investment from government can potentially be an answer to keep this going post-COVID as well.
Yeah, that would be great. Thank you.
Yeah, thank you. Anybody else? Anybody have questions for Jose or comments?
Yeah, Jose, this is Stephen. Thanks for the great overview and the work you're doing. I'm curious about the extent to which, given the participating the network of restaurants and providers you have, to the point about fundraising, are there ways to kind of lift up a little more of that so that you can access some of the sort of quote unquote natural market opportunities so that it kind of starts to encourage more participation, for lack of a better word, almost organically by different organizations so that it keeps the money within the community rather than going outside, since we know the supply chain for restaurants and so forth is a lot bigger?
Yeah, absolutely. I mean, we're looking at, I mean, there's so much out there, and I think right now it's a time for that kind of thinking to, I mean, it's ripe for that and ripe for innovation. And again, there's so many people that are thinking that way that, you know, that's what I'm leaning toward, you know. So if there's ideas that you have, happy to talk offline. And given the background that you have, even from the labor workforce model, definitely would want to talk to you about that as well.
Thanks. And I see that Lynn has her hand up from Rainin. Lynn Vera.
Hi, I'm really encouraged by the fact that these actions have brought workers back into the workforce. And I'm wondering, just as in future funding, and I don't know how, you know, I know there are different buckets of money and they come from different places, and I'm not familiar with everything, but some of this may be able to be funded by, for example, money that's not going into unemployment insurance because people are working and not taking unemployment insurance claims. Or there may be other places where, because of the revenue this generates, you know, it can be, self-funding isn't the right word, but there can be funds allocated or reallocated to help keep something like this going. It's so much better to have people fed and healthy and employed rather than, you know, just decimated and relying on you know, services they can get sometimes.
No, I agree, Lynn, and I think that it's definitely that kind of thinking. I mean, you bring up some really good ideas or potential sources of funding this or a revenue model, and that's the beauty of this council, right? We gather the great thinking like you, and we take this to the next level. So I think there's opportunities like, you know, there's others like you that have really great ideas that we want to capture them. I know that we've discussed how do we gather the knowledge of these 130 restaurants and their own thinking collectively, and even some ideas might come out of there. And I know I've been trying to, I'm going to connect these 130 restaurants with Darcel from Mills to make sure that, you know, from her research perspective, you know, what else can we learn from this effort that can, and what data can we extract from this that we could potentially use as a way to make the case for all these great ideas that, you know, you and Stephen and others are bringing up.
You might want to look at health data too, just because this is probably better food than people are getting, you know, or may have access to elsewhere. And you said it yourself, some restaurants can't even do it. And so that's a much longer term thing, but this has got to impact the health, literally the health of the community.
Yep, agreed.
Thanks, Lynn. Does anybody else have questions? I see no hands.
Can I just give a love fest, Alexa? Can I just give a love fest? I just want to give a love fest. Jose Corona, I'm your biggest fan, like since 1995. Where are you, sweetheart? Oh,
I want to hear.
I've come on camera just for you, just to tell you this is great. What my quick chat about getting philanthropy to step up on the national, I think COVID has exposed a lot about the myths surrounding it, what a successful economy has looked like. And we know that Reverend Barber coming out of North Carolina is doing the Poor People's Campaign in those ivory towers where philanthropy lives that I've never been inside, that I think hopefully we've put you in as a spy. Like, is there any real discussion around how to move national policy to roll back these devastating tax cuts? I mean, on a much broader level around shifting the economy so that we don't have so many people falling through the cracks. Like the exposure of hunger on a very base level with every school district, rural and urban, has really just exposed how poor we are and how great the economic divide has grown in the past 10, 20 years in particular. So are you hearing anything, or is there anything that this council can say to all of you? Michael, I know you're in here too, McAfee, that now that philanthropy is there, like moving away from a programmatic focus to a policy focus that allows us to shift back to a more moral economy.
Yeah, I mean, the discussions are there. And I think the other folks that are at the table, you know, I know Kat Taylor is part of this group, and she has had these policy discussions right now more at the state level with an initiative called Growing the Table, which really looks at these policy solutions. Because you're right, you know, philanthropy, as good as it is and has been, and will continue to play a role in this effort in addressing hunger and other issues, but there has to be policy solutions and systems change to really address hunger and food insecurity in a holistic way. And so yes, the discussions are happening at the national level. And the great thing, I think, one unique asset that we have is the power of the voice of the Currys. And just, you know, I would say, and I'm not saying just because I work for them, just second only to Michelle or Barack Obama, they're probably one of the most beloved family in this country.
Yeah.
And they have the power of their voice and the power of their platform to reach policymakers across the aisles on this issue, because hunger is not a partisan issue. And I think the resources are there at the policy level. It just takes, just like at any policy level, it takes the guts and the stomach to actually do it. So that's what we're trying to push, is trying to put, you know, what levers can we push at the state level, at the federal level. And again, we're engaging people that have those deep ties, the Kat Taylors and Tom Steyers and others that have those networks, to reach out to the policymakers to create this change.
Yeah, it's just time that we, you know, I think philanthropy was born of a time when we were doing good for a small subsection of our economy that, you know, did not fit within the competitive marketplace of capitalism. And so that's where we were like, so for these folks that don't fit, you know, the disabled, those, but it has grown now to where working families cannot feed their children. One of the things that I've heard from families, I mean, it's just heartbreaking that now that students are at home, the kids are eating more, the adults are eating, like they're not even able to make food stamps work and the supplemental meals from the district, and pets, feeding pets, right? Like it's just been a lot, particularly as we've lost income. So I just want to offer that. I said it was going to be a praise report, and then it turned out to just be a Lynette ask anyway, but I'm sorry. But I just really want to appreciate your leadership and your thoughtfulness. You know, in West Oakland, we got our food program up about 8 days into the pandemic. I'm very concerned about when it stops, because what we have found is for many of our seniors, it's been both the socialization, people coming to their homes, some of them are homebound. So the meals, the touch that we were off for admissions day and our seniors missed us. And so we're raising money. I'll have Ron and Jazzy reach out to the foundation for some additional support. But we really are just so deeply appreciative of who you are and how quickly you pivoted. The work for the farmers, just all of it is just such a love story. I hope somebody puts it out in film so we can share you with the world. Mwah.
Oh, thanks so much.
Yes, thank you so much, Jose. It's been such a privilege to get to work with you, and it's amazing what you've been able to achieve. So thank you. Our final speaker is going to be Mark Everton from Visit Oakland. And Mark, do you have slides you want to show?
I do.
Or do you want to just talk?
Yeah, and I don't have that long of an agenda to go over, but Jose, I'm not going to blow you a kiss, but I'd love to give you a hug at some point. What World Central Kitchen is doing, I think Savlon noted it in the chat room. Anecdotally, down in the Jack London district, we've seen a couple of restaurants remain open that wouldn't be open today if it hadn't been for that effort. Derek Johnson and the Home of Chicken and Waffles is definitely one that's benefited from it. I think an ancillary benefit that you didn't mention, though, is restaurants that had received PPP grants from the federal government were then caught on a catch-22. That money was supposed to be used for employment, but yet they were closed and unemployed, and they were ready to give the money back. And with World Central Kitchen, they were able to then open, even on a modified basis, use those PPP dollars and stay open. So anyway, kudos and thanks so much. Let's switch gears a little bit. So Visit Oakland, we're a marketing organization, and what our primary focus on is on hospitality. And you guys have probably heard me say this in the past. Hospitality in Oakland is $1 billion a year business. It's the second largest private employer in Oakland. It cuts across all demographics, all districts. It's truly on every block because it's a wide net. It's not just hotels, but it's restaurants, it's shops, it's really everything. It's the grassroots of Oakland. And when last year National Geographic chose Oakland as one of the 30 best places to visit in the world, they did it partly because of that infrastructure that we've got, the small restaurants, the ethnicity, the diversity, the 130 languages in our public schools. It's really, Oakland is a very different place than the rest of the world is, and they recognize that. And so our role has been marketing it and really promoting what we're seeing, but not really supporting. Our role has always been to be the cheerleader, but not to really be the coach or the trainer. And when the pandemic hit, I learned a very valuable lesson from Barb Leslie in the chamber when she created Oakland's Open with a couple of other organizations to really let people know which restaurants were open, to encourage people to go out. And we pivoted at that point, we being Visit Oakland, and we switched from being the cheerleader to really being a supporter. And so from that, we've created a couple of programs. We just wrapped up yesterday our Oakland Restaurant Week, late summer edition. Normally we run it in January, and our objective is really to get people across the bridge and through the tunnel. We want people that don't normally come to Oakland to come and experience Oakland, so they'll come back again throughout the year. We switched this year, not so much in trying to get people to come visit from out of Oakland, but really to encourage Oaklanders to go out and support the restaurants. So for the 2 weeks, just quickly, we had 345 restaurants that signed up and were involved in it. Was not prefix based. They could do whatever they wanted to do, and we would help promote it. And we were seeing about 1,300 people a day coming to our website. And from there were about 450 of them a day were going to the restaurants' websites to look at their menus, to find out more, to find out when they were open and what they were serving. And so with that, then we did just a hair under 2 million impressions, so about 1.9 million website impressions over that 14-day. And we got some great press. I was able to be on KTVU on a Mornings on 2, and Eater on Berkeley side, and 7x7, Diablo Magazine all carried it. And we ended up with about 3.4 million views about Oakland Restaurant Week. And anecdotally, we were hearing it was very successful. We're going to go back and look at some of the stats over the next week and see what we see. But we're getting a lot of thank yous from restaurateurs to say that it definitely helped out, and that we got people in their neighborhood to put on a mask and walk into the restaurant or call and pick up. And so it was truly a great success in a way that we were able to support it. Kind of as a precursor to that, we created a kind of a wider ranging program that we're calling Spend, Stay, Love. So dollars that are spent in Oakland, stay in Oakland, and it's a way for Oaklanders to show their support and their love of Oakland. So we launched Spend, Stay, Love with Harry's from the city's kind of advice and counsel. And we've included some of our other city partners on it. We launched it the third week of August 24th, and it's going to run through the holidays, through the Thanksgiving holiday, through Black Friday or Plaid Friday. And so that'll go through November 30th. Similar numbers, we've got about 1.9 million impressions. We're getting about 400 people a day going to our website. And you can find that website either by Googling Spend, Stay, Love Oakland, or you can go to visitoakland.com and just scroll down and you'll see it's there. And we're listing a lot of the businesses, not just restaurants, but a lot of small businesses, galleries, and other places that are open, and encouraging people to get out and explore their neighborhoods. We're also featuring a newsletter that's gone out, and we had a phenomenal 22% open rate on a newsletter, which either indicates that people are bored at home and they don't have much to do, or it's actually something of interest to them to see. So we're really excited about this. It's an opportunity for us to kind of mobilize Oaklanders to go support their small businesses. And it's interesting, Jose, a lot of what you were talking about ties in very directly to what we were talking about. Clearly, if we don't all do something, we're going to find ourselves next spring with a very different landscape in the city, and we're not going to have a lot of our small businesses and a lot of our small restaurants, and we're going to not be the Oakland that we pride ourselves on, and that we're recognized around the world as being. So it's important that we do what we can do to save that infrastructure and to support those businesses, and be prepared then for what life's going to be like post-COVID come next spring or next summer. So, but thank you, Alexa, for giving me an opportunity to kind of brief everybody on Spend, Stay, Love, and also Oakland Restaurant Week.
No, thank you, Mark, and thank you for all your work supporting Oakland Restaurant Week. The virtual restaurant week I thought was really cool and exciting, and we definitely took advantage of it in my house. So thank you very much. Does anybody have any questions or comments for Mark? Nope, I'm going to say that's no. All right, well, thank you so much, Mark. We're coming up at the end of our program, and just as we wrap it up, I wanted to just open up the floor to some of our working group leads and facilitators to see if anybody had any final comments. I know, Mieko, did you have anything you wanted to add from your working group working with the Phase 4 group?
Yes, absolutely. I've been working with Jean Marie Durant and the rest of the Phase 4 team to kind of do little case studies on some different events that are already happening outdoors in fairly safe conditions. And so we're putting together some recommended guidelines that we'd like to present to the county so that we can create a more equal playing field. Council member McElhaney had mentioned some of the frustrations, I think, around outdoor events that are already happening currently. So we're trying to get to work on that. We're also going to be recommending some guidelines for performers for these cultural type events. That is a working group that the county health department is actually putting together now. So we're looking forward to hopefully moving some of those opportunities forward.
That's great. That's really exciting. Thanks for sharing, Mieko. And I like your art in the background. I'm not sure I've noticed it before. It's very cool. Does anybody have questions or comments? Any final thoughts from any of the other working group leads? All right. Before I wrap it up, I know that we were joined by Michael McAfee, one of our co-facilitators from Policy Link at the end. Michael, I don't know if you're still with us, but I wanted to open up the floor to you too if you had any comments or thoughts in our second to last meeting. We might have lost Michael. Yeah, I think he might have dropped off. Okay, well, we might give everybody back a few minutes. Then at the end, I want to thank all our presenters for sharing all this great information. Thank you to Anika and Jose and Mark and Micah for sharing out. And just, you know, in terms of next steps, as we were discussing at the top of the program, we have one more meeting to go. It's hard to believe that 6 months has passed since we started doing this. But our last meeting is going to be next month on October 19th. So look forward to that. The working groups will be continuing, I know, to meet in the interim. Marissa will be continuing to organize and lead that effort. And we'll look forward to turning that interim report into a final report and adding just some final progress updates and any final thoughts from the advisory council. So I'll wrap up the program there by just, again, such sincere gratitude to all of you for being with us during this challenging time, during this crazy, evolving crisis within a crisis within a crisis that we're all living through. But again, as some of the other speakers said today, just constantly inspired and given hope and lifted up by the work that our community is doing, and just by all of the efforts that have been created by the people who are here and all the people in your networks and the people you're touching and working with and supporting. So thank you all so much. And stay out of the smoke. It's supposed to clear, I think, fingers crossed, in the next day or two. So I hope you're all able to get outside eventually and stay safe and spend some time with your families and loved ones. So thank you so much. Take care.
Bye.
Thank you.
Bye. Thank you.
Bye.
Thank you, Alexa.
Get you off of here. I'm having too much fun.